Hello, welcome to the presentation today by Doctors Health in Queensland. We're so happy to have you here, whether or not you're listening to this on your computer at home or attending in one of the intern orientations around the state. My name is Dr. Rhys Thomas. I work as a psychiatry registrar within Metro North, and I also sit on the management committee of the Doctors Health in Queensland.
Hello, my name is Dr. Khursandi. I'm a retired anaesthetist, previously a DCT for many years, that's Director of Clinical Training, and I've been involved in Doctors Health for over 25 years. We'd like to know about you too. We'd like to know which medical school you attended and which rotation you're going to start with next week.
So Di, we're here today to talk about Doctors Health in Queensland. What actually are they?
Doctors Health in Queensland is the name by which two organisations are known. One is the Doctors Health Advisory Service in Queensland, which was founded over 30 years ago and has supported many doctors in difficulty over the years. It currently gets about 200 calls a year with 500 follow-up calls. The Queensland Doctors Health Programme has been, since 2016, has been funded by money received from the Medical Board of Australia via an independent body, Doctors Health Services, a subcommittee of the AMA.
Gosh, Di, that organisational structure is a bit complicated. For our purposes, what should we remember?
You just need to remember Doctors Health in Queensland. So Rhys, you're a lot younger than I am and your intern year is much closer to you than mine is. Why do you think Doctors Health is important?
Thanks, Di. Indeed, I am slightly younger. We know that the transition from being a medical student to being an intern is a very significant one. It is one of the hardest transitions that you will go through. The intern year can be very stressful, both personally as well as professionally, and for some people this may affect them more than others. We know that clinical responsibility is shared within the team, but we know that for interns, they take a lot of this on personally, and that doesn't stop as your career progresses. We want to make sure that you have the right support and resources to get you through. Your health is important to us and as well as to your medical education unit. So I'd like you to insert the following phone number into your phone now. The number is 07 3833 4352. That's 07 3833 4352. That's the number for our confidential helpline.
Thanks, Rhys. So Doctors Health in Queensland aims to promote the health and well-being of doctors and medical students in Queensland. As Rhys said, it's a 24-hour confidential helpline for doctors and medical students. We also deliver education about doctors' health and providing quality care to doctors who are your patients. We're an advocate for doctors' health and we network with other organisations to improve doctors' health.
So Di, if I were to call that helpline, what would that actually look like?
Well, the helpline, the number of which you've just got, is staffed by volunteer GPs who will take your call and counsellors. We then link doctors with the health support that they need. It's free, it's confidential, and it can be anonymous if you don't identify yourself. Sometimes concerned family members call on behalf of a loved one. If you're in person, we would like you to get into pairs or threes and discuss what hopes do you have for this year and what fears do you have for this year.
We'll take a moment to pause so that you can do this, and we'll come back to this activity later.
Thank you for that. Rhys, what are the issues in doctors' health?
Thanks, Di. This is an issue that's really important to me. We know that 50% of junior doctors experience moderate to high levels of distress. We know that burnout is common within doctors. We know that in the Beyond Blue study, 1 in 5 medical students reported suicidal thoughts in the past 12 months. And we know that suicide in doctors is common in both men and women. In addition to this, harmful alcohol use was reported in a significant minority of Australian doctors.
Rhys, could you tell us more about suicide, please?
Suicide in doctors is unfortunately a very well-known phenomenon. While the reasons for each individual are indeed quite individual, we do know there's some commonality. Sometimes there is an association with substance abuse, sometimes there's an association with mental or physical illness, and there's often a dislocation from supports. Peers and colleagues often fail to recognise those at risk, or if they do realise there's something wrong, they're unsure of how to help. This holds true for family and friends as well. A lot of people assume that because we're doctors, we know how to seek help. There are some very important campaigns that are out there addressing suicide in the general population, but I find that these sorts of programs, they ask if someone's okay, but not what to do about it. Sadly, some suicides are preventable, but up to 50% of those that complete suicide do not seek help. And that's the number that we're here to change. So moving right along to a slightly lighter topic, Di has a wheel that she will now be talking to us about.
Right, well, this is your personal wellness wheel, talking about life balance. Are you in balance? And as you can see, the segments are intellectual, emotional, finance, health, both physical and mental, social, vocational, environmental, romance, psychological, and spiritual. So I'd like you to mark your self-estimation of where you are along each of these radii and see what it looks like. Then you join up the points, and what do you see?
So Di, if I were to look at my wheel, I'm looking at the finance column, and due to the recent absence of any international travel, that one's looking pretty healthy for me, maybe an 8 out of 10. And because I live alone with my rescue greyhound, we'll call the romance a solid 9 then, right, Di?
Forgive me laughing. Yes, Rhys. Well, that's very exciting. I'm not going to probe further about you and the greyhound. So your tyre is only a little bit flat.
If you've got a copy of the wheel in front of you, we'd like you to take a moment to fill it in for yourself and see what areas you need to be mindful of.
When you talk to each other in pairs or threes, what did you discover? Now, obviously, if you're in your living room or you're listening to the voice-over PowerPoint, you won't be able to respond, but you may be able to respond if there's a presenter there. So we'd just like each of you to report on what you discovered.
As you can imagine, we can talk about this till the cows come home, but ultimately, this is actually a deeply personal issue. My colleague Di has a story she'd like to share.
Oh yes, thank you, Rhys. Over 30 years ago, I became depressed with a moderate depression. I was crying all the time. I carried on working because any distraction was welcome, but I used to sit in theatre and cry, and I couldn't sleep, so I was taking tablets for that. After a year, I finally decided I better do something about this, so I spoke to my GP and went to see a psychiatrist. I cried through every session with the psychiatrist. I wrote about my experience in an article in the BMJ in August 1998. Diana Strange Khursandi. You'll find it if you Google it. It took me several years to get over this very distressing experience, but some good came out of it because a few years later, with a colleague who'd had a similar experience, I founded the Doctors' Health group in our college.
Thank you, Di. I think it's heartwarming to hear your story, but heartbreaking at the same time that even to this day, it sounds like such a relatable tale. Thank you for sharing with us.
Rhys, you're a psychiatric registrar. Perhaps you know a bit more about how we can prevent these stresses that we experience getting to us.
Thanks, Di. I actually always find this a really difficult topic to talk about because part of me thinks that we know for a fact that many of the factors involved with physician burnout and the lead-ons with physician suicide are actually out of control of the individual. And I worry sometimes that we are de-emphasizing systemic factors and emphasizing individual factors, which are but a drop in the ocean. However, we do know that there are some things that we can do for ourselves to help mitigate these effects. These include being kind to yourself, being kind to others, attending to your basic physical needs, eating, hydrating, sleeping. If you're ever my resident, you will hear me say the words, everyone has a right to be fed when we take a break for lunch. I've also heard that exercise is quite good for you, and that's why I go to the gym for 1 hour, 1 day per week. Ensuring you maintain hobbies, debriefing with peers, family, and friends, trying to maintain friends from outside of work and medicine, and making sure you have your own GP and that you actually attend your appointments with them. There's actually a couple of helpful acronyms that we like to use. My personal favourite is HALT, which is you should take into account whether or not you are hungry, angry, late, or tired before making any big decisions. And I think Di's got one as well.
Yes, the other one on the slide is I'm safe, which stands for I'm free from the effects of illness. Don't come to work if you're sick. Medication. Just be aware of what medication you're taking. That I'm not stressed, and that, of course, is sometimes unavoidable. That I haven't drunk alcohol or taken recreational drugs before I come to work. That I'm not fatigued. Again, this is a system issue. And that I have been eating. Rhys, can you tell us something about how we pick up the signs of fatigue and burnout?
So as you might expect, it's very individual for the person, but there are some common themes that we see. In particular, exhaustion. So that can be both physical and mental. Thoughts like, I'm not sure how much longer I can keep going like this. I just can't do this anymore. Depersonalization. So a little bit of dark humour and sarcasm is pretty normal within our population, but when it comes to the point where you're feeling the need to excessively ventilate about your patients, your job, and your colleagues, and you're not actually getting the relief that one would normally get from that. And lack of efficacy. Now this one's tricky. I've had my own experiences with burnout where, despite evidence to the contrary, I was becoming convinced that I was a terrible doctor. Now, in hindsight, this is probably because I was working every second weekend for about 6 months straight. But at the time, I remember thinking to myself that I really wasn't meeting my own expectations of my work performance and didn't feel I could manage things at the standard that I expected of myself. This flows on nicely to our next topic, which is how to seek support. It will really vary depending on where you're working, what kind of individual services are available. But some commonality includes approaching some of your colleagues. So that might be your fellow residents, it might be your senior residents, it might be your registrars. In some units, it may also be your consultants. The medical education units do have ultimate responsibility for the well-being of their junior medical staff, and they should really be one of your first ports of call, particularly if your personal supports aren't quite cutting it. In addition to this, in Queensland Health, we have access to the Employee Assistance Program, known as Benestar. In addition to this, there may be a hospital psychologist that you can access.
Thanks, Rhys. And there are some other supports which are important. Find a general practitioner and go and see that person. Find someone that you like and you get on with and you feel comfortable with. On this slide, you'll see that there is a Find a Health Professional consent portal, and you can click that, and this is facilitated by the Doctors' Health in Queensland. Don't forget that you can consult your GP by telehealth.
Di, what are some of the other resources that we have access to outside of work?
Well, some people are able to manage the stresses themselves, but also with their own circle of support, which could be your friends, your family, and perhaps your mentor. Very important to try and find a mentor, somebody who you can trust and you can talk to your issues about. Try and find more than one mentor, because if you're moving around, it's good to have one in each location. Join a medical defence organisation. They will help you in various different areas of concern. When you become a training registrar, your college may well also be able to help you. And we have already mentioned the Doctors' Health in Queensland helpline, which you have now got in your phones. And there are 2 other services, Doctors for Doctors, and there are modules on Doctors' Health online training. You've got the links here.
Thanks, Di. We also have a few online resources that we've made available to you, and when these slides get distributed, you'll be able to click the link below. Although DHQ is funded by the Medical Board of Australia, we are absolutely dependent on our donations to keep running and to continue providing our service. Fortunately, we are a registered charity in the state of Queensland, which means that with your newfound salaries, you're actually able to tax deduct when you donate to us. I know it's a little bit on the nose to ask you for money, but we can't continue functioning and providing the service that is so important without our donations.
Rhys and I would like to thank you for listening, for being involved, and hopefully answered a few of your questions. But if there are any questions, please do ask your presenter, or you can email us at DHQ. Thank you.
Yeah, thank you, Di, and thank you everyone for listening today. We really appreciate the time that you've taken to listen to our presentation. Obviously, we hope that you'll never need the services of DHQ, but I want you to remember that if you do, we're here for you 24 hours a day.